Hello friends, I am Dr. Vicky Jain, plastic and cosmetic surgeon practicing in Mumbai. In my previous video, I had told you about lipoma and what are the causes of lipoma. In this present video, I will be talking about the clinical examination, diagnosis, and if in case you want to go about surgery, how we can go about the surgery. So clinical diagnosis. Clinical diagnosis, it's more of physical examination where you can confirm lipoma. Then what we can do to surely be clear about the lipoma. We can get a local ultrasound or maybe a MRI where we can come to the extent of the lipoma, how huge is the lipoma, and if in case surely it is a lipoma or not. We can do a fine needle aspiration cytology in which we can see the lipoma cells which can be diagnosed under the microscope and confirm that it is a lipoma. Fine needle aspiration cytology cannot confirm between lipoma and a liposarcoma, so a confirmed biopsy is required. If you decide to get it removed, can we do it under Mediclaim? Very important question. It can be done surely under Mediclaim insurance. It can be done completely cashless facility where you don't have to pay a single penny. It is covered under your medical insurance. You can go to the best possible hospital, the best possible doctor. If you need any help, you can WhatsApp me on the below number and I can help you to get through your Mediclaim also for the lipoma removal. Then you will ask me, is surgery only the option for removal of lipoma? Yes, I would say surgery is only the option for removal of lipoma. There are ways of removal of lipoma by surgery. One is a excision method where we take a big cut and we remove the lipoma. Second is liposuction. Liposuction is which we take a small hole distant from the lipoma and we suck out the lipoma. And third, which I prefer, the puncture hole technique. Puncture hole technique is the best possible technique in which we make a small puncture, we put the instrument, we define the lipoma and we remove the lipoma en masse with the capsule. So lipoma removal can be done on an OPD basis. OPD basis means you can come in a small clinic and get it done, or maybe in a small hospital in the minor OP also if the number of lipomas are less and a smaller lipoma is to be removed. It can be done under medical insurance also, as I told you. It can be covered 100% under cashless where you don't have to pay a single penny if you have a medical insurance, corporate or private. If you need any help, you can WhatsApp me on the underlying given number and I can help you to get 100% coverage for your lipoma treatment. Now I will be talking why to remove a lipoma. It is suspected to be cancerous. It is increasing size. It has become hard. It is painful. It is cosmetically not looking presentable. It is obviously seen and people are asking you what the swelling is and bothering you, and somehow you are bothered mentally rather than physically by it. And one more thing, that the doctor is suspecting it is not a lipoma and it is something else. That's where lipoma has to be removed. One more important thing, if it is interfering with your day-to-day activity, that's where lipoma has to be removed. Now you will be talking about the recovery of the lipoma. Recovery of the lipoma, after surgery you can go back home if it is done on an OPD basis, or for medical insurance you have to stay 24 hours at least in the hospital, and after surgery in a couple of days you can go back home. It might be a small stitches might be taken which have to be removed maybe after 10 to 12 days. It's a totally safe surgery. For other queries, please do WhatsApp on the given below number. If any queries are there, please do like, subscribe and share for plastic surgery information. Thank you.